At the outset, good evening to all of you. It's going to be 4:02 now, and I shall speak for about 40 minutes. In the next 20 minutes, I shall give you time for asking me questions. My topic today is arthritis, myths and facts. A myth is a false belief, and a fact is a fact. Now, people have a lot of myths associated with arthritis. They say that arthritis means the origin of arthritis is in the nerves and they can go and see the neurologist. It is not like that. Arthritis means that this disease is concerned with the joints, with the structure surrounding the joints. That is called arthritis. So arthritis is purely a problem connected with the joints and the structures surrounding the joints. It is not an orthopedic problem at all. Orthopedic problem majority deals with fractures, joint replacements, dealing with surgeries connected with the spine and the bones. If you come down to arthritis, some people have a feeling that it is due to a nervous disease. Tamil எடுத்து பார்த்தா they will say இது எனக்கு நரம்பு problem. I think most of you know Tamil. It is not at all connected to the nerves. An arthritic disease can have some element of a nerve dysfunction, but it is not a neurological problem. With the result, people with arthritis invariably should consult their family physician or they should consult a rheumatologist. And now rheumatologists are plentifully available throughout the country and throughout the world. The second important myth people have is that arthritis occurs only in the elderly. You can see your father, mother, or you can see me at the age of 67. If I limp a little, you may tell me that I have arthritis, and you can say, "Oh, you're going old, that's why you have arthritis." It is an absolute myth. Arthritis can affect any age. It can affect children, it can affect adolescents, it can affect adults, it affects the middle-aged, and it can also affect the elderly. So there is no specific predilection for arthritis at all with respect to age. That's very important. The third important myth we have is that arthritis affects only women. It is not like that. Arthritis can also affect men. One arthritis which predominantly affects women in the world is a condition called rheumatoid arthritis, in which the patients will complain of pain in the smaller joints of the hands, in the toes, associated with swelling of the smaller joints of the hands, the wrist, the elbows, the knees, the ankles and the feet, and this will be associated with severe early morning stiffness of the joint. If the wife has got rheumatoid arthritis, she won't be able to box her husband in the afternoon. It's in the morning rather. So that is rheumatoid arthritis. So rheumatoid arthritis is more commonly seen in women than in men. There is a condition called gout. What is gout? It is a condition like in diabetes. The uric acid goes up in the blood. It will go beyond 7 milligrams in the blood. When it goes beyond 7 milligrams, it will go and get deposited in the joint. It becomes a terrorist there and it precipitates inflammation and people will develop swelling of the joint. Gout classically affects only males. It does not affect the females. You can ask me why. The female hormones are protective with respect to protection of people from developing gouty arthritis. So gout is predominantly seen in males. Rheumatoid arthritis is predominantly seen in women. And then you have another disease called ankylosing spondylitis. What is the problem with that? Ankylosis means stiff. Spondylitis means spine. The spine will become absolutely stiff and people will not be able to bend forward. They will not be able to push the spine backward. And this ankylosing spondylitis, the classical picture which all of you should know of ankylosing spondylitis is these people have low back pain, which is worse in the night, burst in the morning, disturbing their sleep, associated with severe early morning stiffness of the back. Characteristically, the pain and stiffness will become better as the day progresses. Ankylosing spondylitis is seen both in males as well as females equally. So it is absolutely a myth to say that arthritis affects only women. It can affect both men and women. It can affect people in all the age groups. It is only a problem connected to the rheumatologist because it is a problem in the joint. It does not necessity to see a neurologist for that or go and see an orthopedic surgeon. Now some people come and ask me, Dr. Ramakrishnan, this arthritis is due to gas. It is all gas. It is absolute nonsense and myth. Some people will come and tell you, எனக்கு வாய்வு இங்க பிடிச்சிக்கிச்சுன்னு. வாய்வு வந்து he is unfortunately was who is வாய்வு? He is a son of Hanuman. So let me be very frank. No Hanuman will get into any joint. So it is an absolute myth in allopathy that arthritis is due to gas. Many people will come and say, see, I got gas here, I got gas here. So my gas, I got a catch here due to gas. It is nothing like that. It is an absolute myth. You should take it from your head and throw it in the dustbin right now. In allopathy, there is no concept of gas. Once this gas element comes into consideration, people will ask for a specific diet in arthritis. You should not take tubers. Anything which is grown below the ground are called tubers. You should not take because it will cause gas. It is absolute nonsense. Arthritic patients can take potato, they can take whatever they want which is grown, yam, anything which is grown below the ground because it does not cause arthritis at all. If you don't want to take potatoes, I love potatoes. I'll give my address, you send it across to me, I will make potato fry and eat. So please, if you have arthritis, somebody has got arthritis at home and is completely deprived of potato, kindly make him some nice puri potato and give it to him at 5 o'clock in the evening for breakfast. There is no specific diet. Now you can ask me, Dr. Ramakrishnan, is there any specific diet for arthritis? There is no specific diet. You must take a well-balanced, nutritious diet with plenty of green leafy vegetables, fruits, 1 glass of milk twice a day, and adequate amount of water. See, we are in a city, especially like Chennai, where we sweat a lot because the weather is humid. So people should drink at least 2.5 liters of water daily, unless the doctor has restricted fluid intake like people with renal failure or cardiac failure. The moment we tell people take 2.5 liters per day, immediately when they go for a morning walk at about 5 o'clock on the terrace, they get into the overhead tank and completely drink all the water in the overhead tank. They take 3 liters and 4 liters. That is absolutely crazy. This 2.5 liters to 3 liters of water should be distributed throughout the day. From the morning time you get up to the night you go to sleep. That's very, very important. Just don't go open the tap and drink 2.5 liters in the morning itself and say, I am drunk for the day. In about 2 hours, all of them will come out as urine. So you should equally distribute the water throughout the time you're conscious. And I hope most of us are conscious from about 6 o'clock till 10 o'clock, unless we keep on sleeping. That you should not do. Now, there are certain important diets as far as arthritis is concerned, especially fish. Fish is good for inflammatory arthritis because it contains certain substances which bring down the inflammation. There is a very important substance available in your kitchen cupboard. All of you use it daily. All of us have been eating right from childhood. It is used as a spice. It is used for application on the skin by women. And what is it? It is turmeric. Turmeric is a very good anti-inflammatory substance for arthritis. In fact, abroad, they have turmeric capsules available. It does not mean that you go straight to the provision store and buy 2 kilos of turmeric and take it immediately. You can have some quantum of turmeric in your food. What I am telling you, our grandma remedies are still very, very useful in this world. Don't decry Indian food. Don't decry Indian food. Indian foods are definitely a source of good antioxidants and anti-inflammatory substances, as well as immunostimulant, especially for this COVID time. You can have ginger, you can have turmeric, you can have pepper, you can have other spices. So that they are all supposed to be anti-inflammatory and also immunostimulants to increase what we call the strength of the immune system. Now there is another important myth that there is no specific diet, but one disease has got a specific diet. What is that disease? That disease is called gout. What is gout? You should not have any doubt about gout. What is gout? In diabetes mellitus, the blood sugar goes up. In gout, the uric acid goes up. So what is uric acid? Uric acid is an end product of whatever protein we take. Whatever protein we take gets into the body, ultimately it gets converted into uric acid and it is excreted either by the intestine or it is excreted by the kidney. Now what happens is the normal level of uric acid in the blood should be only 7 milligrams. When it exceeds more than 7 milligrams, the uric acid will go and get deposited in the joint. When it gets deposited in the joint, it will precipitate inflammation and people will develop arthritis, and this arthritis is called gouty arthritis. Gouty arthritis, like I told you earlier, occurs more in males than females. It is genetic because it is due to enzymes. So there is a hereditary. The father may have gout, the sons may have level of gout, the grandfather also may have a gout. So in addition to all the properties the parent gives, they also will present people with gout. That's very important. Classical clinical presentation will be swelling of the big toe, which abruptly occurs and becomes fine within 2 to 3 days. So if anybody develops sudden onset of pain and swelling in the big toe, in the wrist, in the elbow or in the ankle, which settles down in a couple of days, and again you get another attack after 6 months, it means this patient may have gout and you have to consult a rheumatologist and you'll have to get a serum uric acid done. Since uric acid is associated with proteins, all people with gout should definitely restrict high quality protein. Just because I am vegetarian, non-vegetarian, I am not asking you to avoid non-vegetarian, but people with gout should definitely restrict high quality protein, especially red meat. Number 2, they should avoid wine and they should avoid beer. That's very, very important. Red meat is very, very dangerous for people with gout. They should restrict non-vegetarian to the barest minimum. When I tell this to certain people from certain parts of India, where fish eating is as common as taking rice, I'll tell them, please don't take fish. They'll say, can I take small fish? Then I'll tell, you are fishing for trouble. Whether it is small fish or big fish, fish is fish. It contains high quality protein and people should not take. You can restrict your intake of fish, no problem. I'm not asking you to renounce the world and not eat anything. But people with gout definitely should have restriction of high quality protein like non-vegetarian, and they should avoid all this beverages, so many beverages containing fructose, they should completely avoid that. That's important. So specific diet for rheumatoid arthritis is not available. Specific diet for other diseases are not available. But there are some sources which can give antioxidants and immunostimulants. That is all our grandma remedies available in the kitchen cupboard, like turmeric, ginger and other spices. That's very, very important. Fish is a good source because fish has got anti-inflammatory property. The content of the fish oils, Suppose I am a non-vegetarian, pure vegetarian, fish oil capsules are available in the market. The original genetic form is called icosapentaenoic acid. It's available in the market and people with arthritis can even consume it. It is just available across the counter. I want to make a very small request to all of you. Now, so many immunostimulants have come into the market and there are so many advertisements about it. You take this, your defense system will become fine and you will not get COVID. That is all absolute nonsense. None of them have been put to scientific rigorous studies at all. The best source for increasing your immune system is the food what you eat. There is no necessity to supplement with all the supplemental foods. Well, people can take a tablet of ascorbic acid 500 milligram and also take some tablet of zinc and vitamin D also, because vitamin D deficiency also can decrease your, they say it's associated with decreased diffuse defense system activity. So that is with respect to diet.